I'm Peggy Peck, MedPage Today, reporting from the American College of Cardiology in Chicago. The diabetes drug Pioglitazone may have a benefit in cardiovascular disease as well, according to research reported here and in the Journal of the American Medical Association. I'm talking now with Dr. Steve Nissen, who is reporting results of the Periscope study this week in JAMA, an early release, and also reporting at the American College of Cardiology meeting. Dr. Nissen, can you just give us the highlights of the study?
Yes. Well, we asked a question. We began the study long before the current controversy about the best treatments of diabetes, long before the Avandia controversy or the recent Accord trial. And we asked the question, does it matter how you lower blood sugar? It wasn't a question of how much you lower blood sugar, but it was a question of whether different approaches, different drugs might produce different outcomes. We chose two drugs. One drug is an insulin-providing drug, glimepiride, also known by the name of Amaryl. The other is an insulin-sensitizing drug known as Pioglitazone or ACTOS. And the question was, if you got blood sugar to the same level, would there be a difference in the rate of progression of plaque buildup in the coronary arteries in patients that got an insulin-sensitizing drug versus an insulin-providing drug?
And Doctor, you were measuring the plaque through IVUS. Is that correct?
That's right. So using intravascular ultrasound to measure the plaques. These probes allow us to make very precise measurements of the amount of atherosclerotic plaque in the coronary arteries, and to do that at the beginning of the study and then do that 18 months later. And the question is, has the disease progressed, stayed the same, or regressed? And
you found?
The group that got the conventional drug, one of the more widely used drugs in the world, glimepiride or Amaryl, had unequivocal, statistically significant progression of their disease. The group that got Pioglitazone or ACTOS actually had no progression. They had a complete halting of progression of disease, and this was highly statistically significant. This is the first time we've ever been able to show that any diabetes therapy can actually slow the progression of heart disease. And heart disease is the #1 killer of diabetics, so obviously it's an important finding.
And also, is this the first time that a drug other than a statin has been shown to have this effect on IVUS?
Yes. This is the first time using intravascular ultrasound that anything other than a statin has been shown to slow the progression of coronary atherosclerosis. So it is an exciting result. It tells us something very important that we now need to decide on how to pursue, namely that we can't look at diabetes as simply a disease of blood sugar. It's really about the specific therapies we use. We must now have comparative outcomes trials for all the different diabetes therapies. It's not one size fits all, and we need to learn the lesson here that it's not about lowering blood sugar, it's about preventing cardiovascular disease.
Thank you, Dr. Nissen. So to recap, Pioglitazone, ACTOS, a diabetes drug effective for lowering blood sugar, may also be effective for slowing the progression of atherosclerotic plaque, but more research will be needed. For MedPage Today from the American College of Cardiology in Chicago, I'm Peggy Peck.